Hello, my name is Gary Karslan. I'm a student PTA at CBD College, and today my first client is 42 years old female who has a right superior labral tear from anterior to posterior and is currently 5 days post-surgical repair. Let's go. So this patient is in the acute phase of rehabilitation, which is in the initial stage after the surgery. And the primary goals during this phase are to protect the surgical repair, also reduce pain and inflammation, and begin gentle movements within an MD's prescribed limits to prevent stiffness and promote healing. The restrictions on range of motion and activities indicated that the patient is still in the early stages of recovery. So number one is, of course, to protect the surgical repair. Number two is to minimize pain and inflammation. Number three, maintain and improve the passive range of motion. Number four, educate the patient. And number five is promote functional mobility. There are several exercises to perform at this stage of healing, and I will be actually demonstrating all of them later on after my explanation. So the first exercise is called pendulum exercise. And the purpose of this exercise is to promote gentle movement of the shoulder joint without active muscle contractions, reducing stiffness and improving circulation. As from the purpose, you might already understand that we're not going to be moving our joint by ourselves. So what we need to do, we need to lean forward at the waist, allowing the affected arm to hang down. And so we're going to use our body gently sway to create small circular or pendulum-like movement with the arm. Basically, we need to perform for 1-2 minutes and several times per day. Pendulum exercise. As I said before, we need to move our body, but not the main joint which we're trying to work on. So to make it move, freely sway away in different directions using your body to move. So basically it looks like this, something like this. So this is the affected joint. We're standing and we start moving our body, but not the hand. So hands start swaying all around. So you do some kind of movements. Okay. It looks something like this. The second exercise is called like passive shoulder flexion with assistance. So the purpose of that exercise to maintain and gradually improve shoulder flexion range of motion with prescribed limits without active muscle contractions. So what we need to do, the patient first of all lies supine and using their unaffected arm or the assistance of the therapist. The affected arm is gently lifted to a maximum of 90 degrees of flexion as tolerated without causing pain. We need to perform 10 repetitions and 2 or 3 times per day. So the last one, but not the least, exercise is isometric shoulder exercise. But we need to be careful on not using our biceps brachii. So the purpose of that exercise is going to be to maintain muscle tone and prevent atrophy in the shoulder muscles without any active joint movement, of course. And so I will explain how it looks like and then I'll demonstrate as I said. So basically, the patient performs isometric contractions of the shoulder muscles by pressing against the wall or door frame. For example, they can gently press dorsal side of the wrist against the wall with elbow in a neutral, um, about like 30 degrees of flexion. Like you cannot have it like fully extended or flexed, so you have the minimum like using of your biceps brachii. I would say even without any using of your biceps brachii, you need to kind of that's you need to concentrate on this really very well and understand that you cannot have your biceps contract, and you need to use a towel of folded towel in between the wrist and the wall, uh, and basically you need to perform a right shoulder abduction. So we need to hold each contraction for from 5 to 10 seconds. Perform 10 repetitions for each muscle group and 2-3 times a day. So, but as I said before, we need to exclude our biceps. So in that case, as I explained, we need to have our our elbow flexed like 35 degrees, not 35 degrees. So we need to have a towel between the wall and your dorsal side of the wrist, putting it this way, standing perpendicular to the wall, and we pushing our hand towards the wall, doing the motion which is called abduction. Pain levels are well controlled, and for example, consistently below 3 out of 10, and the inflammation has significantly reduced. Adequate healing of the surgical repair is confirmed by the MD with stable and improving passive range of motion without causing undue pain. The patient demonstrates improved functional mobility and can perform daily activities with minimal assistance or discomfort. The patient follows the prescribed rehabilitation protocol and shows understanding and compliance with activity restrictions and exercises. So at this point, the focus can shift to more active range of motion exercises, gradually strengthening and further functional training as appropriate for the next phase of the rehab. I hope you like this video. Uh, Thank you very much, and of course, you have a really nice day. Thank you.